Hi there, my name is Peter McAvoy and I'm from the School of Population Health at Curtin University and the Centre for Clinical Interventions in the North Metro Health Service. With my colleagues Ben Horgan, John Bullen and Viv Chu, who you'll meet shortly, we've been funded through the WA Department of Health to develop a statewide mental health research strategy. We wish to first acknowledge the Aboriginal people of the many traditional lands and language groups of Western Australia. We acknowledge the wisdom of the Aboriginal elders, both past and present, and pay our respects to the Aboriginal communities of today. Research is central to our ability to better understand issues that matter to the community and to developing new and innovative ways to provide the highest quality of mental health care. It's become clear from our consultations that the community understands that mental health research is underfunded. We expect that having an evidence-based strategy in WA will guide funding priorities and will ensure that mental health gets its fair share of research support moving forward. We've been busy over the last few months consulting with a number of mental health stakeholders in WA to try to understand the research priorities that matter most to people with lived experience and mental health professionals. We now need to hear from as many people as possible with lived and professional experience in mental health to ensure we have the priorities right. We've named this project Co-Designed Roadmap for Mental Health Research Strategy WA, or co-ROMAS for short, to emphasise the fact that our approach has been co-designed by people with lived and professional experience right from the beginning. Our team would now like to tell you more about how we hope you will help us to identify the health research priorities for Western Australia.
Hi there. My name is Ben Horgan. I'm a Consumer and Community Involvement Coordinator working at the WA Health Translation Network. My role enables me to support research to ensure that people who have lived experience in the subject being investigated are involved in all aspects of the project, from design through to translation into better outcomes for our community. To identify mental health research priorities for WA, we have decided to undertake a Delphi method. The Delphi method is a process used to arrive at a group consensus by surveying a panel of experts. Experts respond to several rounds of questionnaires and the responses are combined and shared with the group after each round. To achieve a truly comprehensive level of consensus, we will be inviting two groups of subject matter experts. The first will be people with a lived experience of mental health. That means if you have lived with a mental health issue or a member of your immediate family has, where the issue has made an impact in your life, we would invite you to register your interest in taking part. The second group of subject matter experts are the people who work in mental health across all disciplines, whether you're mental health care worker, researcher or policy officer. To make this a truly statewide process, we must receive a diverse and comprehensive amount of feedback.
Hi, I'm John Bullen. I'm a Noongar man from Wadandi country in the southwest of WA. I'm also a senior lecturer in Curtin Medical School. I'd like to tell you more about the Delphi survey, which will have 3 rounds. Once we have our lived experience and mental health professional panels established, their job will be to rate a number of research principles and questions with respect to how important they are to the community. The research principles address how mental health research should be done to ensure it's appropriate and likely to have a positive impact on the community. The research questions cover a range of issues, which we have developed from extensive literature reviews and consultations with people with lived experience and professional expertise. There'll be some general research questions and some more specific research questions on different topics, which are shown on this slide. Although some questions in this survey refer to early life, priorities in the areas of child and adolescent mental health, perinatal and infant mental health and chronic conditions are being identified outside of this particular survey. During the first survey round, you'll be given the opportunity to rate research questions within all of the topic areas or only the ones you feel you have enough experience to be able to provide an opinion on. You'll also be invited to add any research questions that are not on the initial list that you feel should be considered as a priority at this time. You'll be asked to score each question on a 9-point scale, with scores averaging 3 and under being deemed unimportant, 4 to 6 important but not critical, and 7 to 9 critical. After round 1, all research questions rated as important by at least 80% of the lived experience and professional panels will be deemed a priority and removed from round 2. Likewise, all questions that received less than 70% important response rate will be removed, as this will be deemed too low to be deemed a priority. In round 2, what you will see are all the questions that you answered in round 1 that 70% and 79% of both panels rated as important to see if you would like to change your rating. You will also see all the new questions that were added by panel members in round 1. In round 3, the same process will occur with a smaller list of questions that still sit within the 70 to 79% range from round 2. After round 3, we'll achieve consensus and have a true list of prioritised questions of mental health research in WA, giving us the basis for our statewide mental health strategy.
Hi, I'm Viv Chu and I'm also part of the co-ROMAs team. So how can you get involved? You can email us at co-romas@curtin.edu.au to let us know that you'd like to participate, and we'll keep you informed. You can also go straight to the Expression of Interest website on the screen. Complete the Expression of Interest registration form and we'll get back to you to confirm your nomination onto one of our 2 panels. Please also feel free to disseminate this information widely to your networks. It is very important to the project that we have panels that are as representative of the WA community as possible. Once your nomination has been confirmed and we are confident that the panels are representative, we will share the online Delphi survey link.
One of the major challenges to the success of this Delphi process lies in the breadth of the subject matter. Mental health is a massive issue across the entire state, affecting millions of us for different reasons and in different ways. Because of this, we must ensure we hear from as many West Australians as possible. Only with a truly comprehensive response from as many different people and mental health workers as possible can we achieve an outcome that will deliver on the needs of all West Australians. With your help, we believe the findings from this study can have a significant impact on the future success of mental health research in Western Australia. Living with a mental health condition is one of the most challenging issues facing us today. If we can use our own experiences to inform the work that needs to be done to improve lives in WA, then we can truly make a difference. The Co-ROMAs project gives you an opportunity to make that difference. Please join us in our quest to deliver on a strategy that helps West Australians to live mentally healthier lives.